Tony Stein is Chief Executive of Healthcare Management Solutions. They operate 65 care homes across the UK, and I'm delighted to say Tony joins me now. Good afternoon to you, sir.
Good afternoon, Matthew.
It's well, first of all, perhaps you could tell us what the scenario was like in your care homes during those first few months of COVID.
Like everybody else, it was a bit of a shock to everybody. We had a really serious situation that we had to manage. Everybody was trying to understand exactly how this virus was going to unfold, and we were obviously very, very concerned about the risks that we had in our care. So managing staff and the staff movements back out into their homes and back into our services probably the do for us. But obviously there were many issues around admissions and that we had to handle as well. So, we were all learning, but we were on a very, very steep learning curve.
Could you give us a little insight, perhaps, into what kind of contact your homes were having with people coming from hospital untested right at the beginning? Well,
I think the real key for me.
I tell you what, your line is breaking up, Tony. If you wouldn't mind hanging up, we're going to call you straight back and see if we can get a clearer line, because it's important we hear exactly what it is you have to say. I just want to take you back to that press conference we heard Boris Johnson talking to Patrick Vallance. It was the 25th of March, and Boris tells Patrick Vallance, on the numbers of people who have the disease asymptomatically, I've seen a study quoting Oxford academics saying that as many as 50% may have it. And Vallance said, he pointed to studies in China and Italy. He also said that new antibody tests would be able to work out how many people had the disease asymptomatically, and that was vital to the effort. But of course, we didn't have them right at that moment in time. Tony Stein is back with us. Tony, hello again. Yes, the first contact that your care homes would have had with patients being discharged from hospital, were there concerns then about COVID?
There were absolute concerns about COVID, and obviously, as a care provider, we have a real responsibility to our residents and to our staff, and we were very concerned about how we handled that. So the way we viewed it was we looked around at our homes, we determined which of them would be best able to manage the potential for infection. Obviously, all of our staff are trained in infection control in terms of PPE, and some of the homes we said we couldn't take people into for various reasons, maybe the layout of the home or the dependency level of the residents. And other homes we felt we would be perfectly safe to bring people in, treat them as we treated every admission as if they had COVID, and we isolated them until such time as we knew for sure, one way or another. And then once we were happy, that was fine.
And so, can I ask what kind of impact in terms of mortality COVID had on your homes?
Well, the mortality rate in our homes was mercifully very low compared with many operators. But it'd be very difficult for me to say that was just because we're better at what we do. I mean, I'd like to think that was the case, but I think the reality of this disease was that some people probably had more of their homes in very densely populated areas, and the asymptomatic transmission from staff going in and out was probably a greater risk for them than perhaps others who had more rural settings and less movement.
Can I ask you, and this I don't want to be disingenuous here, it's just I was at school when did I leave school? I left school in 1983, and I knew about viruses to some degree from my biology O-level, and I was aware, not specifically about COVID, obviously, but that viruses, it's possible you have asymptomatic transmission. I was aware of other diseases that were carried that way. What do you think about our Prime Minister saying that he didn't know about asymptomatic transmission? What does that? How do you feel about that?
Well, what I feel about this is I feel very strongly about it. I think, the benefit of hindsight is wonderful. I think if you remember at that time, the government was looking across the water at what was happening in Italy, for example, where people were dying on hospital trolleys because there wasn't sufficient capacity within the hospital to look after people. So one of the first responsibilities they had was to make sure there was sufficient capacity to deal with what was likely to be a very rapid onslaught of people coming in desperately needing acute medical care. They also had a responsibility for those elderly people who were in hospitals, who were asymptomatic and who were fit for discharge, to leave them in hospitals and to prevent them from being sent out to care homes and to leave them in hospitals where there was a huge risk of them contracting COVID would have been irresponsible too. And I think from the perspective of care homes, well, you know...
it's very fair. It's very fair, Tony. I'm listening.
There were 25,000 people discharged out of hospitals. I just heard the number you quote. I mean, I do know that there was a study done in Scotland, and this was really important. They looked at every single discharge between March and May of 2020 from hospitals into care homes in Scotland and concluded, and that was every single one, so there were 4,960 some discharges. They concluded that statistically there was no link between the discharges and then deaths in the care homes. And actually what they concluded was there was a greater statistical link between the size of the care home and deaths in the home. And I suspect that is because, and I don't think it was just the size of the home, I suspect that was because larger homes tend to be situated in more densely populated areas, and those were hardest hit by COVID. And so your staff were going backwards and forwards into those sort of densely populated areas.
I'm going to have to jump in. The phone line is absolutely dreadful, and it's such a shame because I think I could hear about 95% of what you said, and the sense has come across clearly. It's just such a shame about the line. Thank you for really actually a very fair and balanced appraisal from your perspective as a chief executive of a group that owns 65 care homes. That was Tony Stein from Healthcare Management Solutions.